Federal government, Lagos State government insist no COVID-19 test required for returning students. Governor Rotimi Akeredolu gives 7 days ultimatum for herdsmen to vacate Ondo forests. In international news, COVID-19 vaccination targeted campaigns begin in China, India, and USA. And in sports, Ozil arrives Turkey to complete Fenerbahce deal.
This is ANN.
I am Olajumoke Olatunji. Nigeria's COVID-19 tally has risen by 1,617 cases on Monday, raising the country's total to 112,004 cases. The Nigeria Center for Disease Control also says it has so far tested more than 1 million persons since the first confirmed case of COVID-19 was recorded last February. The new cases were reported in 17 states and the Federal Capital Territory. The agency said almost half of the new cases were from Lagos, with 776 infections. 16 other states also recorded high numbers of infections. And CDC says 622 more patients were discharged across the country after testing negative to the virus. Federal and Lagos governments are insisting no COVID-19 testing is required for returning students. Director of Press and Public Relations, Federal Ministry of Education, Ben Gong, says only temperature checks should be carried out on students and other persons crossing any school gates. The federal government has urged teachers, school administrators, and other stakeholders in a statement to ensure strict compliance with COVID-19 protocols, including compulsory wearing of face masks by all students, teachers, and workers in all schools, temperature checks and provision of hand-washing facilities at strategic locations in all schools. The federal government also advised against large gatherings, such as school assembly and visiting days. Schools are also to avoid overcrowding, and authorities are asked to limit class sizes and hostel occupancy. The federal government says schools must ensure functional health clinics with facilities for isolation and transportation of suspected cases to medical facilities. Despite the federal government's directive on school reopening, Imo State government has postponed by 1 week resumption of schools in the state because of the second wave of COVID-19 pandemic. State Commissioner for Education, Professor Bernard Ikwawa, says the postponements became necessary to curb a further spread of the rising cases in some urban areas of Owerri West and North. Ikehuaga says the government has a team of personnel that would ensure strict compliance with COVID-19 protocol when schools reopen in those states. Elsewhere in Kaduna State, the government has closed public and private schools till further notice. Permanent Secretary, Ministry of Education, Phoebe Yayi, disclosed in a statement on Monday that only Kaduna Polytechnic and the National Open University were exempted because of their examination timetable. Yayi said no definite date has been set for schools to reopen. The federal government has ordered an immediate closure of the headquarters of the National Identity Management Commission in Abuja. Minister of Communications and Digital Economy, Issa Pantami, who gave the order, also directed the National Identity Management Commission, NIMC, to open 20 locations in the FCT. NIMC spokesman Kayode Adegoke announced 20 centers were reactivated within the FCT to ease the enrollment process. The federal government also says the deadlines for the registration of all subscriber identification modules with valid national identification number were still in force. Ondo State Governor Rotimi Akeredolu has warned all Fulani herdsmen in the state to stay clear of all forest reserves in the state. The governor has given a 7-day ultimatum to that effect at a meeting with leaders of Hausa, Fulani and Ibira communities in the state. He said the activities of the herdsmen are posing a huge threat to security in the state. The governor says this is a major step towards addressing the root cause of kidnapping, in particular, and other nefarious activities, detailed and documented in security reports. The governor also banned night grazing and movement of cattle within cities and on highways. Lagos State chapter of the People's Democratic Party has endorsed Oyo State Governor Seyi Makinde as the Southwest leader of the party. This endorsement was stamped by the Lagos Deputy Chairman of the party, Waliu Hassan, who says Makinde has worked diligently in the interests of the party. But Ekiti former Governor Ayo Fayose has always called Governor Makinde a baby politician, not yet ripe for that huge role.
Coming up, African news. Senegal battles bird flu outbreak. And later, international news. COVID-19 targeted vaccination campaign began in China, India, USA.
You are watching ANN. Somewhere in the world, every second of the day, news is happening. And of course, Nigeria is bustling with news day and night. That is why ANN doesn't sleep. Our eyes are peeled, wide open, so no story escapes our radar. We stay abreast of world events and happenings at home. We keep you up to the minute in the world of sports. We give you information to stay on top of your investments and all the hard facts you need to navigate your day. If you miss us on air, you can keep up to date on our website and on our social media platforms, Twitter, Instagram and Facebook at ANN Africa TV. We are ANN, Africa News Network. We do news right in a truly African spirit.
Welcome back. This is ANN News. A strain of the H5N1 bird flu has been detected in Senegal, causing the government to slaughter thousands of chickens while investigating the origins of the outbreak. Reporter Asta Toll has more.
The outbreak of the H5N1 bird flu was first reported on a poultry farm. Senegal's veterinary services report over half the birds were killed out of a flock of 100,000. This comes as the country is dealing with the economic impact of the COVID-19 pandemic.
A health response is needed at this time to prevent the disease from spreading. I think that economically, the disease could put the poultry sector at risk, especially as the sector is already hard hit by the COVID-19 crisis.
The outbreak was first discovered in Chess, a region east of the capital Dakar. Officials are still investigating its origins. Those working at poultry farms in the meantime are trying their best to mitigate the damage.
We disinfect all persons and vehicles that need to enter our premises. For the time being, we have suspended all foreign visits until further notice. We have also closed all ventilation ducts on our site to prevent any air that might be contaminated from entering.
Infections in humans usually occurs when one has come in close contact with the infected birds or environments contaminated with H5N1. Human-to-human transmission is still rare, though the disease, according to the WHO, has a mortality rate of around 60%.
The African Union is urging African countries to place orders for secured COVID-19 vaccine doses. The African Center for Disease Control and Prevention, Africa CDC, has secured nearly 300 million doses from manufacturers from member states to supplement the COVAX program. And correspondent Koleta Wanjohi has the story.
The African Union is aiming to immunize at least 60% of the continent's population against COVID-19 in order to achieve herd immunity. 270 million doses of COVID-19 vaccines will be bought from 3 manufacturers, Pfizer, AstraZeneca, and Johnson & Johnson. The first batch of 50 million will arrive between April and June this year.
Countries should now take on this. At least the ball is in the camp of the countries to engage and start placing their orders, okay, so that we can actually know the volumes that have been pre-ordered, and then the Afreximbank can engage with this, the manufacturers, and do the payments.
Afreximbank will make an advance commitment of up to $2 billion to the manufacturers on behalf of the countries. Individual countries will then agree with Afreximbank on how to pay back for what they have ordered, either through their own resources or through a payment facility that will have them spread out installments over 5 years. The World Bank is also offering about $5 billion either for countries to buy more vaccines or pay for delivery of vaccines committed by Afreximbank. The Africa CDC says this should help countries prepare for vaccine rollouts.
Especially also given that the World Bank is talking to countries and making available resources to be used for vaccination and not just procurement of vaccines. So the opportunities are out there for this accelerated preparedness to occur. It shouldn't be a complex exercise at all. I think if you remove the whole thinking of a coach, ultra coaching, which I don't think I subscribe to that, then it becomes a logistic arrangement that is very, very within reach of our capabilities as a continent.
Distribution of the acquired vaccines will be highly dependent on individual member states, but guided by a strategy from the Africa CDC.
We need to also factor the fact that 80% of our economy is informal, and say, okay, how do we expand these vaccines to the informal sector, like the young people that are out there hustling to earn $1 or $2 a day, and with all the motorbikes, the bus drivers and others. So that's why the community engagement component is so important, so that the vaccines become available and there's also willingness to uptake those vaccines.
This new acquisition complements the approximately 600 million doses the continent will receive from the COVAX facility. The global scheme aims to immunize 20% of the continent's population. And while Africa has not yet secured enough vaccine supply to cover its 60% immunization target, the journey towards mass inoculation is getting underway.
And new archaeological discoveries were announced on Sunday in the Sawara area of Egypt. These findings are said to include important cultural relics from a burial temple from the ancient kingdom and New Kingdom periods. Famous Egyptian archaeologist Zahi Awas says the excavation of the burial temple of Queen Meet near the Pyramid of Teti, the first pharaoh of the 6th dynasty of ancient Egypt, was one of the most important discoveries of this time. Howard said the Pyramid of the Queen was found in 2010, but her name was not known. Now, he said her name near it was found on a tablet at the entrance of her funerary temple. The team also unearthed 22 tombs around the funerary temple, where they found 54 wooden coffins from the New Kingdom dating back more than 3,000 years. Important cultural relics such as papyrus, texts, mummies, wood carvings, stone tablets, and clay pots have also been found.
When we return, international news. COVID-19 vaccination targeted campaigns begin in China, India, and USA. And later, sport. Ozil arrives Turkey to complete Fenerbahce deal.
You are watching ANN.
We are on the road every day, canvassing throughout Africa for news you really need. We follow this story everywhere, from every corner of Nigeria to the wide African expanse. We bring you what's making headlines. We connect you with news you can use. ANN, African News Network. in a truly African spirit.
Welcome back. This is ANN News. India has begun what many believe to be the world's largest COVID-19 inoculation exercise. Health workers began receiving COVID-19 jabs on Saturday in the country that is home to the world's largest vaccine makers.
Dr. M. Siddharth, who works as a dean in a dental science college, became the first person to be inoculated at this center. As he wants to encourage his team to volunteer for the vaccine, he decided to have the first go. Despite initial apprehensions, he feels vaccine is a necessity against the virus.
I think at this point of juncture, where the COVID-19 pandemic is raging all over the world and it has not reduced, one must weigh the benefit more than the risk. And I think the benefit of the vaccine is much more than the risk.
About 100 people voluntarily received the vaccine in each of the 3,006 centers in the country. Doctors say these vaccines are safe and the only prevention available in addition to masks and social distancing.
COVID-19 is one of the most dreaded diseases. You know what the mortality is like. And you also know that it is coming up in new forms, in new places. There are new emergent strains. So vaccine is a must. You cannot do away with the vaccine.
You know, corona is a very contagious disease, and by taking the vaccinations, we can further stop the spread of the corona in the second or third phases of the spread.
It is still not clear if the vaccines will be free of cost for the general population, but since they are made in India, they will be cheaper as compared to other countries.
A new round of the coronavirus pandemic has appeared in villages in China's Hebei province near the capital, Beijing. Just a few days ago, more than 500 persons were confirmed contaminated by COVID-19. Because Hebei province is one of the biggest traffic hubs and the Chinese New Year is approaching, strict measures have been put in place like emergency relocation and vaccination. As correspondent Sun Tunyon reports, high-risk groups are also being vaccinated to build antiviral barrier.
The city of Shenyang is gradually building an anti-coronavirus barrier for its 8 million residents, what health experts call the first step to a citywide inoculation in the future.
I'm at a community health service center in Shenyang Sujiatun district. The center has been giving COVID-19 vaccines to people with a higher risk of exposure to the virus, such as police officers, medical workers, and bus drivers since December 27th.
So far, the center has vaccinated more than 1,300 people between 19 and 59 years old. For many, this is not only a lifesaver, but also a boost to morale.
I have faith in our country's science and technology, and also its research results.
Certain groups of people, such as fever patients, pregnant women, and those who are allergic to the vaccine, may not be suitable for inoculation.
My wife's a conductor. She has hypertension, so she couldn't take the shot. I'm a bus driver who takes many passengers every day. I was concerned, then came the vaccination. Now I can work with my mind at ease.
But experts warn COVID-19 vaccinations are not a cure-all that will protect the recipients 100%.
Getting vaccinated doesn't grant people total immunity because it's only preventive. Recipients still need to wear masks, wash their hands regularly, and reduce gatherings.
After taking the first shot, recipients have to remain in the medical center for a 30-minute observation period. Personal hygiene, proper rest, and diet are also advised before the second shot.
Now to the United States, where at least 11 million Americans have received a first dose of a coronavirus vaccine, while more than 31 million doses have been distributed. State and local level authorities are struggling to iron out logistical challenges of the rollout. Some of the emerging most chaotic scenes involve the most vulnerable population. Senior correspondent Nitsa Soledad reports.
Seniors across the United States are desperate to get a coronavirus vaccine. In Florida, hundreds of them line up overnight to get inoculated, waiting hours for an uncertain outcome. The rollout has been chaotic and frustrating.
I wish I could get the vaccine today.
Burj Malikian has AIDS and has not yet been able to get the vaccine.
People are desperate. Nobody's being able to sign in. And, it's better to just go to the hospitals and see what's going on. I went to 4 different hospitals. There's the big lines for 65 and older, big lines, hundreds of people. And they're all old, they can hardly stand.
Florida is one of the first states to expand vaccinations to all people 65 and older. So far, only around 3% of the state population has received its first shot.
The limited supply of vaccines we currently have is simply not enough for the enormous demand that we see from our community. Miami-Dade has been working hard to distribute the limited supply that we've gotten from the state. Yesterday, we opened our scheduling portal and 80,000 people tried to access the webpage at once to book appointments for only 3,000 slots.
Many nursing homes are complaining that they have not received any vaccines, while wealthy donors and younger retirees are already being inoculated. Officials are urging people to be patient.
Yes, I'm so happy. I wanted to get the vaccine for so long. I've been waiting, watching the news from 5 to 7 every day.
This assisted living facility in an underserved area of Miami finally got its turn. Its manager told CGTN he had been waiting for weeks. With little assistance or guidance, states are pretty much on their own, grappling with an unprecedented vaccine rollout.
Up next, sport. Ozil arrives Turkey to complete Fenerbahce deal. Please stay with us.
You are watching
Welcome back. This is ANN News in Sport. The Youth Sports Federation of Nigeria has announced the 38th edition of Vamat Cup will hold in early February at the Kano Pillar Stadium in Kano. National Secretary Patrick Okpayere says preparations for the championship will start with the state playoffs, which kicked off last Wednesday. The federation reminded the teams the body weight of each player must be 58 kg with a height of 1.75, while arrival date in Kano for the competition is February the 5th. A championship is organized annually in honor of late military head of state General Murtala Mohammed. Mesut Ozil arrived in Turkey to start his move to Fenerbahce. A former German midfielder of Turkish descent hasn't played for Arsenal since March after falling out of favor with manager Mikel Arteta over concerns about the player's work rate. After 7 years at Arsenal, which he joined from Real Madrid, Ozil is heading to one of the favorite clubs of Turkey's president Recep Tayyip Erdogan. Fenerbahce won the last of its 19 Turkish league titles in 2014. The team has not been in the Champions League group stage since a match-fixing scandal broke in 2011. That is ANN News this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatunji. Have a pleasant evening.